Hello and welcome to Bottom Line. Well, on a day the entire country went on lockdown, Northeast registered its second confirmed coronavirus case. A pastor from Mizoram who had travelled to the Netherlands tested positive for COVID-19. The tests were carried out at the GMCH Guwahati Medical College Hospital yesterday. Precautionary measures were stepped up immediately in the hill state and contact tracing initiated on a war footing. Meanwhile, Manipur too, which registered the first case in the region, the first COVID-19 confirmed case in the region, is still working on a war footing to identify every individual on board the flight to Imphal from Kolkata, which was taken by the girl who had returned from UK and had tested positive. And as all these measures continued, authorities were forced to impose the lockdown in certain areas, even as the state governments worked on ways and measures to provide immediate relief to people, relief to daily wage earners, to sort out all the issues, to sort out the apprehensions. So there are three things. One, the number of cases in Northeast went up to 2, but all the preventive measures are in place. The Mizoram government has urged people not to panic. In certain areas, the authorities still had to enforce the lockdown, which is unfortunate. Thirdly, yes, apart from capacity building in hospitals, getting test kits, getting equipment, the governments in the Northeast are now focusing also on providing relief measures to the people. We'll discuss at length all these issues, and for this I'm being joined from Guwahati by Northeast Live Editor-in-Chief Wasbir Hussain. Live from Shillong, I'm being joined by Powell Socklet, senior journalist. In course of the discussion, I'll be joined by Bhrigu Talukdar, guest faculty, Jamia Millia Islamia, Delhi. I'll also be joined by our Manipur Bureau Chief, Sharat Chandra, who will be connecting with us live from Imphal. We'll also try and connect over the phone to Dr. Sthapana Sharma, who is assistant professor at the GMCH. A very warm welcome all of you who have joined us now. Wasbir, second case in the Northeast. The sample from Mizoram had tested positive last night in GMCH. However, the authorities, the Mizoram government responded immediately. Contact tracing is being done on a war footing. The family members of the pastor are on quarantine. Others are also being identified. It is very important at this moment, as we have 2 cases in 2 days, very important for the public not to panic. Wasbir.
You are bang on track there, Nabarun. This is the second case in the northeastern region, the 50-year-old pastor from Mizoram who tested positive. But one thing which is emerging as a pattern, Nabarun, is that the 2 cases, the 23-year-old girl in Manipur as well as this 50-year-old pastor who was tested positive in Mizoram today, both had a travel history. So one thing we can take solace is the fact that there has been no community transmission or community spread so far in the Northeast, which is a very good thing. In a population of 45 million in the Northeast, spread over 8 states, we have so far only 2 positive cases. But there is no scope for complacency, and it is here that the 21-day lockdown, which was announced by the Prime Minister last night, will definitely come in handy. One more thing which I would like to point out, Nabarun, is the fact that we have to realize, as the citizenry, as citizens, we have to realize that we always talk about our rights. Now is the time to also focus on our individual responsibility. Rights as citizens, we are going to claim our rights from the government, from the law, from the statute book, that is the Constitution. We have our rights. But what are our responsibilities? This is the time to demonstrate our responsibilities, and we are actually on a contract between the citizens and the state, and this is unprecedented. And let us go back to the 2 cases. The focus now is on finding out, as you have said, the series of people who these 2 patients, 2 positive cases had come in contact with, but there is no cause for panic. I was talking to the Mizoram Chief Minister this afternoon, and he was saying that the patient is stable and the government is already thinking, not deciding, but thinking of sending the COVID-19 positive patients for home quarantine, indicating that the government is absolutely confident and that there is no cause for panic. Even if one is afflicted, turns out to be a positive. But I must once again stress on the fact that social distancing is a must and we cannot lower our guard.
Yes, very much. Paul Socklet, today was the first day of the lockdown, but it was quite unfortunate to see still authorities, especially cops, were forced to enforce the lockdown in several parts of the region, including Shillong. And the Meghalaya cabinet meet was held just a short while back in Shillong. Even Deputy Chief Minister Preston Tinsong mentioned, he said categorically that close to 25% of the population is not following the lockdown guidelines. How serious is this, Powell?
Thank you, Navarun. Actually, I will start with I think we are very fortunate that in our state we still have 0 positive case in our state. Though around 80 samples have been tested, but all turned out to be negative. And we should thank the Almighty for that. The question you asked, why the government has to impose curfew? I think one of the few states which imposed curfew in Meghalaya. Reason is that because this is a time as soon as the virus break out and most of the students who are staying outside the state and people who are coming from outside the country, most of them, around 3,000, they have reached the state. And most of the people, I think they take it lightly because since we have 0 positive in our state, people, they take it lightly. Oh, it's not coming, it's not happening in our state. So even during the lockdown, which started on Saturday, and even with the curfew, which is imposed since last night, still we could see people coming out on the street. Some shops are opening, some cars are plying. So I think it's necessary for the district administration, for the state government, to impose curfew so that to make people sit at home.
Is it also because Powell? Is it also because? Is it also because Powell? Is it also because of lack, maybe somewhere lack of awareness as far as the people are concerned? Well, majority are aware of the dangers of this deadly virus, but still we have quite a few coming out, or is it because enough awareness has not gone in? People still believe that well, they are safe, they are young, they are safe, it's a city under lockdown, can have a good ride over my bike, motorcycle, it's pleasant, empty streets, so let's take a bike. I'll also take Wasbir's view on that, Pavel, very quickly.
I think I will partly agree with you because government has taken enough steps to make the people aware through print media, through electronic media, through social media about the danger of this virus. And I think we have also some, not only uneducated people, even educated people, so still are coming out to the road, to the street. Maybe they think, like I said, they take it lightly because we still have 0 cases in our state. Maybe they think it's not coming, or maybe of that maybe it's also due to some
0 cases in the state. 0 cases in the state. Maybe that could be
danger of this virus.
Yeah, that could be a reason for complacency. But Wasbir, even Manipur was 0 till yesterday morning. Even Mizoram was 0 till today morning. So you never know. It's always very important to be careful. 0 becomes 1 in no time.
See, Navarun, if you look at the global situation, it took 67 days for 1 lakh people. It took 67 days for the first 100,000 people to be affected around the world. Secondly, for the next 1 lakh people, it took only 11 days. And for the third 1 lakh people to be affected in the world, it took only 4 days. You know, that is one of the points which our Prime Minister emphasized during his address. Now we cannot be complacent at all. And as far as awareness is concerned, I am afraid, Nabarun, that I still think that the people are not fully aware still, even despite the entire world being afflicted by this deadly virus. People in many parts of the world, including the Northeast, are not fully aware. I'm afraid, and I'm sad to say that, despite the literacy rate in the Northeast being more than 60%. And now my appeal to the governments in the Northeastern states will be to come up with pamphlets and literature in the respective tribal languages. And that is yet to happen, and that has to to happen for people to take things seriously. Now, you know, if we look at the social media posts, some of the posts are quite disturbing. I personally read today during the day as I was scanning through the social media, we have to filter out, we know that we have to filter out large chunks of what appears on the social media, but I'm surprised to see some of the messages, oh, we are tribals, we have got very strong immunity and we will not be afflicted. So these are some of the real posts on the social media. If one is to take this seriously, one has to only conclude that awareness is not complete as yet.
Well, I am now being joined by Dr. Sthapna Sharma from Guwahati Medical College Hospital. Dr. Sharma is also looking after the screening function in the hospital. Dr. Sharma, thank you very much for joining us on Northeast Live. Sthapna Sharma, two confirmed cases of COVID-19 confirmed in Northeast so far. My first question to you is that both the patients had travel history. One had returned from the United Kingdom, the girl from Manipur, and now we have a pastor from Mizoram who had been to the Netherlands. Now, this raises a question. Are airport screenings not enough, not sufficient to detect any anomaly when a person is coming in? This is the first question, because they have may have been, both the persons have first been screened in Delhi, then they traveled to Kolkata, directly to Guwahati. So at least they would have had at least 2 screenings minimum, but still it was not detected. Well, we will just try and connect once again to Dr. Sthapna Sharma on this. This is one question. But coming back to you, Powell Socklet, well, it is very important. It is very important at this time. Well, we have got the line back with Dr. Sthapna Sharma. Dr. Sharma, thank you so much for giving us a bit of a precious time. My question to you is that two confirmed cases of COVID-19 in the Northeast so far, and both the patients had travel history. One had returned from the United Kingdom. The other from Mizoram, the pastor from Mizoram, has just recently been to the Netherlands. Now, my question is this. Both these persons may have had gone through at least 2 screenings in the airport, be in Delhi, Kolkata, Guwahati. So are these airport screenings not enough to detect a possible anomaly?
Both the cases had travel history, that's so true. And when they are being screened in the airport, they are only screened for the temperature. And at that time, that might not be revealed. That is a preliminary screening. But more than that, they need to come to the hospital officials and inform about their travel history. It is only after when they inform, they come themselves to the hospital and inform about the travel history, along with their signs and symptoms. If they are suffering from cough or fever, then only we do the main microbiological testing, and then it is being caught. So we cannot only rely on the airport screening for any person with travel history.
So in such a situation, wouldn't it have been a better idea? Of course, now we have international flights suspended, so no question of anybody coming in. But in the run-up to this, wouldn't it have been a better idea if anyone coming from a foreign country would have been placed in quarantine in Delhi itself, or wherever they land, before they move on, before they move to their respective states?
See, the pandemic that has come, it was all of a sudden. We were not prepared for much time ahead. So it came all of a sudden, and whatever logistics we have at present, we are trying to make the best out of it. So any person, when they come, they have in Delhi or Mumbai or in Bangalore, they have got the highest number of flights coming from outside. So they'll not be able to accommodate all the passengers coming from them. But then, as it is, hence it's not possible. We have to depend on our regional airports also.
And Dr. Sharma, since you are also actively participating in all the precautionary measures and steps at the Guwahati Medical College Hospital, can you speak a bit about the preventive measures and the capacity building being put in place?
So Guwahati Medical College is also gearing up. They are taking up much active participation in this whole process. We are having a proper 24/7 screening area in the hospital. We are able to accommodate any number of people that comes to us for screening voluntarily, and provided they have a travel history of 14 days with signs and symptoms. And even if they do not have signs and symptoms, if they have a travel history, we welcome anyone to come to our screening area. We screen, we question them, we have a questionnaire, and we have a test. And accordingly, we give them the necessary advice. And secondly, we are one of our whole, two of our floors have been entirely converted to isolation ward. The entire eye department has been now has shifted to medicine ward and the medicine department has been made the isolation ward. So with whatever logistics we have, we are doing our best.
And my last question to you, would you have information on roughly how many samples from other states of the region which do not have testing facilities are we receiving at the GMCH? Any information on that?
We do not have the exact numbers of, at least I do not have the exact number which we receive, but then almost every state, every district, every region, they have their own testing facility. And for confirmation, of course, we have RMRC in Dibrugarh and Guwahati. So at present, I'll not be able to give you the exact numbers, but then we have quite a number from our area itself.
All right.
Done for testing.
All right, Dr. Sharma, thank you so much. Thank you so much. You are the real heroes working day and night in this time of crisis. Thank you so much for sparing your precious time for us. Wasbir, you just heard, of course, the airport screening is just all about temperature. We have had reports coming in where people have taken a medicine to avoid temperature and boarded a flight. Such irresponsible behavior. So possibly, in a country like ours, where we are still struggling to even enforce a lockdown in such a crisis, probably we could have had more tighter measures in place whereby anybody coming on an international flight should have been put on a quarantine straight away when they land at the airport, and maybe they will be allowed to go after 7-8 days. Something like that could have been worked out. Maybe it's not easy with hundreds, thousands coming in, but yes, it's a big crisis.
Well, you see, now, of course, as you have yourself said, now we all know that international flights have been banned. So there is no question of anybody coming in now. But in the last couple of weeks, I think anybody who had come into India should have perhaps been quarantined for 14 days as a mandatory measure. That could perhaps have been done. But as Dr. Stefana said, we are absolutely new and it has emerged suddenly. So the responses took little time. But now that everything is in place, now we want a strict enforcement of what the government has tried to bring about. Like, for example, the complete lockdown and screening in the airports. Now the domestic flights are also suspended for some time. But when the flights resume, we cannot lower our guard for a couple of months. We have to continue with the screening. Now it is extremely unfortunate. Now there are reports coming in that some of the passengers partake of paracetamol before boarding the flight so that when they land, the temperature is under control. So these kind of unnecessary, irresponsible, absolutely unacceptable behavior should not, because at the end of the day, they're risking their own life, they're risking their life of their near and dear ones apart from the society or the community at large. So this is something we don't expect from educated people who are responsible. So therefore, that is one thing which we have a responsibility. That's the point I was making right at the beginning, that we always claim our rights, but we also have responsibilities. This is the time as Indians for us to unite, to demonstrate our responsible behavior. This is the time. One more thing, Navarone, now that the entire state of Assam is grappling with the disease, coming up with preparedness, various measures, like for example, the civil hospital near Sonapur, that is being made into a completely exclusive COVID hospital in case there is need. Now my sources are telling me that the Mahendra Mohan Chaudhary hospital at Panbazar, right in the heart of Guwahati, the government is also have plans to convert it into a complete COVID-19 hospital,
in fact,
should the need arise.
Yes.
And as Dr. Stefana has said, As Dr. Stapana has said, the I wing of the Guwahati Medical College have been completely removed and made into isolation ward. So these are some of the measures, but at the end of the day, we have to be responsible. Otherwise, any number of measures by the government will not be able to contain a deadly virus like COVID-19.
Yes, in fact, Assam has stepped up. Assam has is making rather massive preparations to tackle any sort of eventuality. As many as 6 hospitals, 5 in and around Guwahati and 1 in Chabua, have been converted into corona treatment centers. And also, the authorities, the health minister today informed that the Sarusajai Stadium and the Nehru Stadium would be converted into temporary quarantine centers. So massive measures there. I would also like to clarify here in this show that as far as the case of the pastor from Mizoram is concerned, he did not hide his travel history. He was in constant touch with doctors. Even in Mizoram, he was in self-isolation the moment he reached home and did everything correct. That's responsible behavior.
Yeah.
And that's why probably we hopefully will have not much of an impact as far as this case is concerned. Now, talking about facilities in place, if Powell Socklet, how are the hospitals in Shillong gearing up for any such crisis? We hear that already even private hospitals like Nazareth, Woodland are also dedicating an entire floor for COVID-19 treatment. Any updates you have on that?
Yeah, Navarun, I think despite constraint, the state government has taken a lot of measures. One thing, they have asked the private hospitals to set up separate emergency ward for those who having maybe suspected cases. And the government also has already put in place 3 hospitals: the Ayush Hospital near Negrims, the Rich Hospital in New Shillong, and the Cancer Wing of Shillong Civil Hospital, which are around 200 beds, to prepare for this any eventualities. And the preparedness also, we have seen in our state, all the inter-district traveling has been banned. And more thing I would like to mention here, so the state government has sought the help of the religious leaders. We have seen in Meghalaya is a Christian-dominated state. All the churches and the religious, they have joined hands together to help the government in make people awareness about this virus. I have seen also some of the churches, they have printed some pamphlets about the danger of this virus, distributing to the people. And all the services of different churches in Shillong, in the entire state, which in the entire state, have closed all the services, the meetings and all. They have also seek the help of the headman of the Rang Bashnong in the different localities to make people more aware about the danger of this virus. I think it's very successful.
Within Shillong City, Shillong City, Powell, are public announcement systems being announced, being used for announcements as far as awareness on COVID-19 is concerned? Is that being done in localities?
Yeah, that is done. In every different localities in Shillong, even we have in rural areas also, through different localities, they have their own public announcement. They make that announcement through whichever they get from the government.
All right. Wasbir, the focus now, the state governments, even the center, the state governments are now also focusing on providing relief measures. We have been talking about the daily wage earners, people whose livelihood depends on the day-to-day market activities. Almost all the state governments are now seriously mulling ways and measures to come up with formulae to try and tackle that issue. We have had visuals coming in from Manipur, Imphal West, where 10 kilos of rice were being distributed to people, and similar measures also in other places. Finally, governments also realized that yes, a 21-day lockdown, we have to think of some relief measures for the daily wage earners.
Yes, I think, in a crisis situation like this, when you are you're focusing your entire energy on controlling a pandemic of, gigantic proportions, I think what we lose sight of is the plight of the poorest of the poor, the daily wage earners, the rickshaw pullers, the fruit vendors, the vendors who operate from the street, who survive on their earnings on a day-to-day basis. This is something which everybody lose sight. But yes, the government of India as well as the state governments are seized of the matter. They are aware of the situation. They may be taking 1 or 2 days time, but I expect a proper system to be in place in the next 24 hours. Otherwise, it will be difficult for the people to survive for 48 to 72 hours without food or without any means, without any cash, liquid cash at their disposal to buy foods. And not that food or groceries are easy to get right now. Yes, the government has said that grocery stores are open, but the government's challenge will be to make sure that the grocery stores have the provisions. The supply chain needs to be put in place. Where are the supplies coming from? The Mizoram Chief Minister was telling me today that Mizoram has supplies for 3 months. But what about the other states? We need to know. Government has to come up with more details so that the people are not panicking. So in view of all this, I think that one thing, Nabarun, I want to emphasize on the show is that, the government has to act in close coordination with the NGOs. There are a lot of NGOs. For example, today the heartening news was coming out from New Delhi, where the Gurudwaras are opening their langars both for quarantine facilities of COVID-19 as well as feeding the poor people so that nobody is hungry. Number one. Number two, in our very own Shillong, I think the Marwari community is offering free food from tomorrow.
Yes.
And similarly, a small organization in Guwahati, people in Serving Assam, yesterday I saw some social media post where they said they were going about distributing rice just before the lockdown came into effect. So these are some of the measures. I think the government has to work in cooperation, both on its own, utilize its public distribution system to gear up at this hour of crisis, but also work with NGOs who will be willing, more than willing, I would say, to assist the government and come up with feeding the poor in this time of crisis.
Yes, a coordinated effort is something which is the need of the hour. We'll have to take a very short break here. Stay tuned. Welcome back. You're watching Bottom Line. We're discussing the coronavirus crisis in the region and across the country. We're being joined now live by Bhrigu Talukdar, guest faculty, Jamia Millia Islamia, Delhi. Bhrigu, welcome to the show. We were discussing how also now governments in the region and elsewhere are also focusing on relief measures, how to give essential items, rice, wheat to people, distribute the essentials. But in a country like India, it is one thing to sanction some funds or sanction some relief materials, and completely different to ensure that it reaches the people. How difficult is this task, even if the government sanctions any amount tomorrow for this cause?
Yeah. So it's going to be very difficult. It's a huge country, 1 billion plus population, and we have, the supply chain is a very delicate process. Like it's going from one step to another. It has to move on from state borders to state borders. What we're looking at right now is that they're being stopped at state borders. It's the goods are not yet passing through. I think what it requires a lot of coordination. And also, since the lockdown has been in process, we don't yet know that which personnels are to move around. That has created a lot of difficulty. I think the personnels who will be responsible for maintaining this supply chain to move on these essentials to different parts of the country, I think the administration and the government and also the different stakeholders have to come together for this. It's a huge ask, I'm saying.
And do you think the absence of a ready reckoner, I mean, we have been talking about how NGOs and civil society organizations can be involved in this distribution task, but is it a case that we don't have a ready reckoner, when it comes to go about doing this? We have to sit and make a list and go about it. Is that also a problem? I mean, it's easy to say involve 10 NGOs, but then selecting one and then going about it, is that also a big logistical challenge?
Yeah, because it has not been tried till now, right? So if it has not been tried till now, this is going to be a new phenomena, but we have to crack this code, because otherwise, how do you reach the different no, the kirana shops, which are the locality shops, which will be providing the groceries and the food items to the different parts of the different localities of different urban centers, rural centers. How do you reach them? We have to come out with something very fast. It requires, ASAP, AP. Like it has to be done yesterday. But it's not a big deal. But yeah, we have to. Right now, we have the stocks. People have stocked themselves, but 1 week down the line, 2 week down the line, 3 week down the line, when it reaches to an end, the whole process has to be like the items has to reach the public, because the lockdown is going to be successful based on that the essential commodities are reaching the public. It will stop them like from venturing out the designated areas, the areas that has been earmarked. You cannot move beyond the 1 kilometer radius or something. If they get the items to their localities. So it needs to be done to make this lockdown successful, to stop the coronavirus spread. It needs to be done that you make sure that the essential items reach the last mile. The last mile connectivity is very important right now.
Wasbir, do you think the Food and Civil Supplies Department, any state, is capable of pulling this off, to ensure that the essentials reach the last person? And this is possible. We can do it, or is it too much of an ask for a country like India? Wasbir.
No, I guess
this question is for Wasbir.
Well, you see, Nabarun, to be frank, the Food and Civil Supplies Department is usually an extremely sedate department. And whenever there is a crisis, in the case of a natural calamity like floods in Assam, as we all know that Assam is an extremely flood-prone state, even in those times, the real movers and shakers, as far as distributing relief is concerned, are the district administration. District administration mobilizes people from various departments, the requisition, the services of various departments, put into operation a plan, put into operation a team, and goes about distributing relief during a crisis like floods. But this time, they have much more challenge in hand, in the sense that, you have to make sure that ration reaches the people in the urban areas, in the urban concentrations. So as Brigu was saying, that if you are supposed to buy groceries from a nearby store within a distance of, say, 1 kilometer radius from your home, you have to first of all make sure that the rations, the supplies are available in those nearby grocery stores. So this is a huge challenge. But second challenge will be to keep the supply lines moving. Now their train connections have been snapped, but goods trains are running. Now, my sources are telling me that the Assam government is also in touch with governments in the neighboring states to make sure that the truckers are able to ply. There are some logistic issues where regarding food supplies, food for the drivers, for the cleaners and others who accompany every truck. There are 2-3 people in each truck. So if there is a movement of 200 trucks, there will be 600,000 to 700,000 people per day who have to be fed along the way. So in the case of a 21-day lockdown, these are some logistics which the government is working on. But I think the government is seized of the matter. But the fact that if the intention is there, I think a lot of things gets done. And fact is that if they can collaborate with some of the non-government sector in feeding the poor, not just supplying rations, in feeding cooked food or food packets, as some of the organizations in Shillong are planning, as some of the organizations in Delhi are already doing, I think that will ease the burden of the poorest of the poor section of society. But it's a huge task, but we'll learn on the job.
Yeah, Wasbir, are you suggesting a completely government monitored tie-up with the NGOs, where probably a government official can be in place on the location to monitor the distribution, something like that, a partnership between the two? Is that something that is the need of the hour, maybe?
Well, you see, in this kind of a situation, when there are government guidelines in place, when there is a government enforced lockdown, the government, if no NGO can work on their own, they have to work in tandem, not under, I would not use the word supervision, because some of the NGOs which are specializing in these fields, they are quite capable of dealing with situations like this. Sometimes they are experts in the field. They can do a better job than some of the government agencies sometimes. But since these are difficult times, these are different situations where a government enforced lockdown is in place, I think the NGOs will have to work work in collaboration, in tandem, in sync with the government. And if the two unite, I think they can do a great job in dealing with this crisis as far as food supply to the people is concerned.
Absolutely, Vasbir. Thank you so much for your perspective. We thank you so much for being on the show. Our Manipur Bureau Chief Sharat Chandra will join us live in a while. In the meantime, Powell Chocolate, can you also take us through some of the relief measures being adopted by the Meghalaya government? I hear they are planning to keep the markets open, smaller markets, locality markets open on the 27th for a limited period of time, or maybe the shops open for a limited period of time to ensure that there is no crisis. Is that right?
Yeah, there was a plan to have some small market out in the outskirts of Shillong for tomorrow, but that was shelved because of this 21-day lockdown by the central government. However, the state cabinet, which met today, which your channel also has been telecast, the government has taken a step to distribute food grain through public distribution system to different block level to village level. However, there is a very, very difficult task. Major worry for the state government is how to reach this public distribution system or food grains to different villages which are still unwaterable. In Meghalaya, we have very difficult terrains. There are hundreds of villages who are still unwaterable. So how is it be a major challenge for the state government how to reach out to those people who are in the places in the terrain which are still unwaterable? And 21 days is a long time. That will be a major task, major worry for the state government for those villages who are still unwaterable.
Absolutely.
Like one more thing, like Wasbir has said that there is a Marwai Association in Shillong which has come out to help the state government for distribution of food items to poor people. And we have seen also some of the NGOs have offered their help. We have seen also churches also that they have taken a step to distribute food grain to the poor people. So I think there are positive signs that people should join hands and
Absolutely,
NGOs,
the society,
all people from walk of life, the local Darbar, local committees should come out together to help the state government.
Yes, the society, the traditional bodies in Meghalaya have to come together in this hour of crisis. If I can go to Sharat Chandra in Imphal. Sharat, Manipur has stepped up measures as far as contact tracing of all the passengers on board the flight which was taken by the COVID-19 positive patient who travelled from Kolkata to Imphal. On March 21st, Manipur, the health authorities have stepped up the contact tracing process. How many have been identified? How many put in quarantine? What is the update that you have, Sharat?
Yeah, Nabarun, so far as identification of the passenger, particularly traveling in the 21 March with the infected girl in the Air Asia is concerned, yes, all are identified, and even some are voluntarily reported to the health authority, and some are yet to report to the health authority. Yes, the advisory is being given to all the co-passengers that to report to the health authority, and also to the health authority in the respective district. So it has given the order, the appeal has given out, notice has given out. Now, some few people are voluntarily come into touch with the health authority. At the same time, I think today in the afternoon, I already spoke to the health director, this director health services. He have already confirmed that some are already reported to the health authority, and some already identified but yet to report to the authority. And further, he also confirmed that already they are advised to put into the home quarantine. This is the latest update from the Director Health Services Manipur, Nabarun.
But Sharat, again, when these people have travelled on a particular flight, all their details would be there, at least their contact numbers would be there. Why is it taking so much time to trace each one of them? This is, this is not a local train or a bus. It's people are flying, and their numbers would be there with the airline service provider. If it has not been done, at least all the people should have been identified by today, we suppose?
Yeah, Navarun, so far as identification is concerned, it is already done with this Jet Airways high
Yes, what I mean
authority.
is that reaching out to them,
Yeah,
identification. Yeah.
sorry, Air Asia authority. The intimation is already established with the health authority and the Air Asia management, and already the passenger has been identified. I think maybe by tomorrow, I think all those passenger and co-passenger, I think some already reported, and I think those remain also will report to the authority. This is the hope from the this health director side also, Navarun.
Sharath, my last question to you. What are the relief measures being adopted by the Manipur government, especially for the daily wage earners and people whose day-to-day livelihood depends on the day-to-day market activities? What steps have been taken? We did get a report that there was some distribution of rice in Imphal West, a particular constituency in Imphal West. But statewide, what is the plan? What is the measure that the government is coming up with?
Yeah, well, exactly, Navarun, that is the bigger question and the big worries of the general public here in Manipur. I think every state are facing such a problem. As this lockdown enter day into day, I think this difficulties due to the shortage of essential item also will add the peak. So now lockdown is on, and the people are also abiding the government order. But at the same time, this is the primary task from the authority side to pump in the essential items so that the general people should not have any kind of difficulties due to the shortage of this essential item. So far as Manipur is concerned, yes, today in the afternoon, we have witnessed in some areas distributing rice through the rationing agents of the different localities. That such kind of thing, I think, need to take place in various places in a very daily basis. At the same time, yes, contributing rice is okay, but follow to the rice, many essential items need to be pumped in, and this task need to be done by the authority at the immediate.
All right, Sharath Chandra, thank you so much for all those updates. If I can go back to Bhrigu Talukdar. Bhrigu, the Assam government is making massive preparations for tackling any eventuality. As far as the numbers, the figures are concerned, be it in India or be it the region still has just 2 cases. For a country of 1.3 billion people, we have not yet touched the 600 mark, which is okay. But then numbers cannot be a parameter for gauging the seriousness of this crisis. And in such a situation, it is very important that people abide by the lockdown, let the government take the decisions. So we have an elected government, and let them take a call. And of course, it's a democracy. We can always air our concerns, but we have had rampant violations of the lockdown norms in many parts of the country, including the region. So is somehow or the other, yes, the majority does understand the seriousness of things, but somehow or the other, people are still not taking this crisis as seriously as they should have probably.
Yeah, so it's the thing is that people have to understand that this virus is a very deceptive virus, and it will reach. It smolders in a community for a very it's for some time, where it has a capacity of, like, incubating for 10 days, 10 days to 14 days, and then it attacks. So what is preemptive measures? These are what we call preemptive measures, that so that the curve is flattened. What the whole over the world, what WHO and other countries are saying, that the bump in the curve would be when that existing health facilities will not be able to cater to the rush of infected people. And if they are not able to do, if they are not able to handle this rush, then a lot of people who could have been saved because of proper care would not be saved. So what these measures are doing, that yes, that this is only buying us time. It is buying us time so that each and every person can be given proper care and they're saved. And individuals have to come to know of this, that the seriousness, it's a grave situation, and the gravity of the situation is unprecedented. That it's a desperate times, and this is not something that you have faced, in the last 50, 60 years or 100 years even. And when people understand this, they have to ingrain in their mind that no, this is for the benefit for not only us, for the society, because asymptomatic people are carrying it to the people who are giving symptoms, and it is attacking people who have immunity, which are compromised. It is attacking the elderly. So it is picking up victims and selectively become victims. And it is not only the household that is being protected, it is the whole community is being protected. So one infected person moving on to the different, it will infect different communities. And the recent reports are coming out quite scary that surfaces are carriers. So individuals, people that all over India have to understand that this is a major grave situation we need to counter. We have to be patient, and we have to be we have to respond to the government's call, and the government and the different parts of society has to come together, and you know we have
Yes.
to move over this. We
Yes.
have to ride over this wave. Yeah.
Now, Brigu, coming back to the relief measure
Yeah.
question, relief measure issue. Well, almost every government in the Northeast, we had the Assam Chief Secretary
Yeah.
also saying that yes, the state has 3 months stock of food grains. Similar was the case with Manipur, Meghalaya. Everybody is saying we have at least 3 months stock
Yeah.
of food grains and essentials, which is
Yeah,
fine.
yeah.
But we are here, we are looking at a battle which, God forbid, may extend till the end of this year if things don't fall under control. So, well,
Yeah.
apart from the awareness on COVID-19, it is also important for every citizen, every individual, and probably awareness should also be generated on how, if, say for instance, if 10 kgs of rice were distributed
Yeah.
today, people have to
Huh.
sparsely use the resources as
Yeah.
little as possible. This is something has to be
Yeah.
done. This is something that needs to be done. Just because I
Yeah.
have resources right now, I cannot waste. This is something very critical. 3 months can go in a jiffy
Yeah,
under
easily,
such a situation.
easily.
Rigu.
Yeah, 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 yeah. So in war times, what the earlier governments or the individuals, people who used to face war times, they used to do is that they ration their intake. You have to ration your intake. That what you have today, you have to prepare for the worst. God forbid something happens and the supply chains get affected very badly, and you are not getting enough food grains and the eating materials. Howsoever money you might have, that will not help you out, right? And so in the end, it's we have to like ration our intake, and also look at that. If I have the money, I'm going to hoard everything and deprive other sections of society. See, when you deprive other sections of society, they will move out to gather it for some some sources, and then they might get affected. Indian, which is going to affect you. So it's where you have to protect yourself. You have to protect others as well. You have to also think about others, so that you also in a way around, you're also helping yourselves and protecting the community all over. So right now, it's not an indulgence. We are not having this lockdown as for that we are going to indulge ourselves. That it's
Absolutely.
actually a wartime measure.
Absolutely.
Yeah, it's a wartime measure. Yeah.
Yeah, this is a
Yeah.
time of crisis. All we need is a coordinated effort. We have to walk hand in hand with the government, coordinate. Authorities should not be forced to impose the lockdown. It's our responsibility. Our lives are at stake. The nation is at stake. The safety of the nation is at stake. Thank you so much, Brigu Talukdar. Thank you so much, Paul Soklet, for joining us in this discussion. That's a wrap of Bottom Line.